Good afternoon, everybody, and welcome to our weekly Q&A with the family support team at the St. Louis ARC. I am very excited today. We have a wonderful guest from the Department of Mental Health who's going to talk to you a little bit about a newer role that they've had. It's been for a few years now, but I think it's still new to a lot of people. So we're going to talk today about what an information specialist is and how they can help individuals with disabilities and families in our region. And without further ado, I'm going to ask Matt to introduce himself, tell us a little bit about his background. Hi, Matt.
Hello, Sharon. Thank you so much for the invitation to be with you all today. Like Sharon said, my name is Matt Wagoner, and I'm the statewide director of the Information Specialist Unit. We came into existence in May of 2018 when the division had to make a decision to basically move towards more of a Medicaid-driven system. We were mandated by the Leak Decree, which is a lawsuit we actually lost back in 1983 or 85. You know, how do laws get written? Lawsuits. So we were still mandated to provide some level of support to Missourians with a developmental disability. And so that brought about the Information Specialist Unit. Currently, we've got about 4,000 Missourians in our system, and I have 5 staff and myself. Our overall goal is to get you out of our system, okay? We want to get you Medicaid. We want to get you some sort of a funded service so that you can enjoy the benefits of case management, support coordination, and those great things that the department has to offer.
What's the difference in eligibility for an information specialist contact versus case management?
Okay, so primarily the most important is receiving an active Medicaid benefit. And there's so much confusion tied up around what we do and that. So let me just say that, yeah, we know that it's really confusing. So you are eligible. It is an entitlement if an individual has an active Medicaid benefit to receive a support coordinator, case manager. Okay, so we're mandated by federal law to provide that level of support. Because of the lawsuit, we're still mandated to provide something. And so that's the information specialist. So individuals that, and here we're going to get a little more confusing, and I apologize. Individuals who live in a county that has what we call an intent to serve can receive case management without having a Medicaid benefit, not support coordination, but case management, okay? Individuals that live in a county that doesn't have an intent to serve, most of our St. Louis counties, and there are sporadic counties across the state, they are referred to the information specialist system, okay? Let me kind of knock out maybe a couple of misconceptions. Let's say somebody's got an active Medicaid benefit, but they've been assessed a spin down, okay? Or they're in the CHIP program and they've got a premium. If you're not meeting that spin down or paying that premium, then you would remain with the information specialist system, okay? So typically those individuals who don't have Medicaid or aren't meeting either the spin down or the CHIP premium, something like that, they're referred to us.
And I have to clarify because I don't know if I know the difference. What's the difference between case management and service coordination?
Targeted case management is a specific service provided under the Medicaid billing system, state plan, not Medicaid waiver, just the regular benefit package of your Medicaid, okay? If you don't have Medicaid, it can be support coordination, case management, but it's not a federally mandated service.
Okay, so we have a great question that I think leads into the direction I was going to go next, which is how do people get connected? Are they the ones that should reach out for information coordination? Do you all do any kind of ongoing communication? What does that process look like?
It's a great question. So individuals are referred to information specialists following typically the intake and assessment eligibility process. So they have to start with the regional office, the local regional office. Then based upon that Medicaid status, that would determine, do you go to information specialist? Do you go to targeted case management? Or do you live in a county that's willing to provide a service to non-Medicaid individuals? And then when they come to us, we have an email inbox that we monitor daily. One of my staff covers that every day of the week. So we would hope that you're referred in and we reach out to you. Okay. I think some of the big confusion is information specialists serve the entire state. So I have information specialists in St. Louis, Columbia, Sikeston, Springfield, Kansas City. I have 5. So you might see a phone number come up that's not from St. Louis or where you live. Okay. And so sometimes people are less likely to return a call or answer because they don't know who we are.
That makes total sense. So the information coordinator that lives in St. Louis just will be answering the phone call for whomever calls on the day they're assigned to the line. And if I call the line on Monday and I get an information specialist, will they continue to work with me until my question is resolved?
So if you call the 800 number, you're going to get me. If you email, then you would speak to or work with an individual on my team. Okay. I'm trying to lessen their workload. Will we follow you? Yes. So we're going to work with you until that circumstance or that situation or that need is settled. But we don't carry caseloads. So I have 4,000 clients, 5 staff. That's a pretty unmanageable caseload, right? So we work on an as-need basis, email, and then through the toll-free line.
It's 1-800-241-2741. And then the email is information.specialist@dmh.mo.gov. Shelley wants to know about individuals with autism before the age of 22 who do not have Medicaid. She said she was told they could get case management. Would that be through the Eastern Missouri Autism Project?
That's a great question. So prior to November of last year, case management was being provided to anyone with autism in the St. Louis region. So county, tri-county, all of that. And I'm from Joplin, so I've had to have a crash course in St. Louis because St. Louis
is a different beast, aren't we?
You are your own critter, right? And there are days I just said to someone in St. Louis, I think that I understand it. I've been doing this for 5 years and I still get it wrong. So prior to November, yes, we had everyone that had an autism diagnosis remained with St. Louis and had support coordination case management. Because we are in the process of going through a pretty significant privatization with bringing CHS on board to lessen workloads so that people can get services. Those individuals that didn't have Medicaid and did not have funding through the EMAP were referred to us, okay? Which brings up a great opportunity to just address that. Individuals who express an interest to go on the EMAP waiting list would reach out to the information specialist. They will reach out to me. I will put you on the waiting list, okay? Then once your funding is approved, then we would send you back to support coordination, okay, to receive that service, to manage your funded service, okay?
Okay, I don't want to get into the weeds here, but I also don't like to talk about acronyms without explaining a little bit more about what they are. So the Eastern Missouri Autism Project is an opportunity for people to get some funding for their family member with autism. You're saying they would apply for that through the information specialist. If they receive that, then they can get coordination of how they spend those dollars with a support coordinator.
That's right.
Awesome. That is so helpful to know.
So you wait with us until you're on the wait list, until you're funded. Then when you're funded, we move you out.
Fantastic. So if something changes in a family's life where I think this is one of the tricky things, and I try to explain to families, even if you don't have Medicaid, it's good to apply to the Department of Mental Health because you can be deemed eligible without getting case management, correct?
That's right. That's why we exist, the information specialists.
Okay, and that eligibility is sometimes all you need to be approved for other services, like sometimes through the county board. They'll
Right.
want to know that you have you've been approved, your diagnosis is approved for services. If you go through the door of the Department of Mental Health and they say, yes, you're eligible, but you don't have Medicaid and you can't get case management, you still get one, access to potential other funding resources, and two, access to Matt. So he's going to help you sort through maybe some of the other things that were going on. And I know we've had a number of families, Matt, that have called you on that 800 number, and they really felt like you were able to listen and guide them to the next step. So kudos to you. That's something they've been really happy with.
Right. Right. Well, and it's most important. I didn't share this, and I probably should. I'm a parent. So I jokingly say I'm not just a dirty bureaucrat too, right? But I'm a dad of 2 kids with autism who access services through us, right? So I've lived on both sides of that as a parent and as a provider of service. So we want to do everything that we can to make it as easy as we can.
It makes a huge difference, doesn't it?
Yeah.
Man, I want to open the webpage. I want to make sure you know how to find Matt and the resources he has available. So you'll notice I've typed in dmh.mo.gov, and that's your Missouri Department of Mental Health. You're going to want to go to this top bar and click on developmental disabilities, and then go down to the first green button that says information for individuals, families, and guardians. Now you're going to find a lot of great resources here. There's a newsletter that'll keep you up to date on things. There's a button. I don't even know what's behind the supporting families button, but if you get down here to what type of services are available, you'll see down here the map for the information specialist system and that phone number. So if you lose it, it's right here. Matt, are there resources on this page that you think are important for families to know about that you refer to a lot?
Well, so we refer a lot of folks to the map and just remind families of this is how you contact us. Okay. We realize that being the parent, guardian, family member of an individual or an individual yourself with a developmental disability, stress levels are exponentially higher. So we know that it's hard to manage. So having our number and our contact information stored someplace just makes it easier for you to get a hold of us. The map helps you understand if you're moving or you're transitioning across the state, what can you look to get? So yeah, and then there are other resources. The newsletter has lots of good information, regardless of whether or not you have Medicaid.
Yeah, I love some of the free webinars and opportunities that are available through the division now. And I think a lot of times, not to be mean, but sometimes I find it difficult for families to navigate this page because there's a lot of information up here. And I don't think people think to go to the web page a lot, but you'll see there's some email blasts, there's a training calendar, the technology first page we've referenced here before because there's so many great tech resources. So those are all great. And we do have a question asking if they call the 800 number, will they usually get someone live? And you said that was your line, right?
That's me. So yes, you usually will unless I'm on the phone. But yeah, I'll do my best to if I can't, I'll call you back.
All right. I feel like that's a pretty good overview. I feel like when they created information specialist, I got an idea in my head that you all were going to send out generic updates to families on the information list about different kinds of resources. Is that something that used to happen, or was that just my misinterpretation of the role?
I think that in the infancy of the information specialist, yeah, that was kind of a desire. We really didn't know what we were getting into when we started, right? Dr. Stearns, myself, basically created the information specialist system and began designing forms and kind of had a vision for what it would look like. As it's grown and we kind of have a feel, the majority of what we do is we support families getting Medicaid. Because I don't think a lot of families understand that you might really legitimately qualify for Medicaid. People are, right? Because, there's income-based, poverty-based Medicaid, but there's also a couple of Medicaid programs that are based on the quality of your health insurance, as well as disability. So there's a good chance that a lot of the families that we support and the individuals that we work with might actually just qualify for Medicaid.
Okay. And are you all certified benefits specialists, or are you doing
We're not.
referrals out?
We are not. What we do is we do keep the age blind and disabled Medicaid application on our desktop. We send it out all the time. Okay. We have some access to some Medicaid staff who can help us kind of check on the status of applications, what's needed. So we spend a lot of time doing that. I spend probably 45% of my time supporting families to get started in the Missouri Children with Developmental Disabilities waiver process. So yeah, just another opportunity for families to access a Medicaid benefit and a waiver benefit that they wouldn't otherwise be able to access.
So let's talk a little bit about that children's waiver, Matt. Can you tell us kind of the eligibility for that is a little bit different than some of the other waivers? What does that look like?
Yeah. So MOKIDS, Missouri Children with Developmental Disabilities, I think that's our Missouri title. It's actually the Sarah Lopez waiver, and that gets the federal title, right? Missouri, I will say, doesn't participate in what they call the Katie Beckett waiver, which is another kind of similar waiver based more on medically fragile kiddos. So just, families like, I wonder if Missouri does Katie Beckett. We don't. But MOKIDS, Sarah Lopez basically looks at the parents' income and resources, right? And identifies that mom and dad are either over resources, which means they got too much stuff, too much money, too much cars, too much stuff. And then they use basically the income of the child to award Medicaid, okay? With the caveat that you have to say, I need a habilitative waiver funded service, right? Respite, personal care attendant. You can't just come and say, well, I need Medicaid, right? We've got to be able to justify that waiver funded service, right? Okay. So it's backwards. It's a backwards process. We're basically saying mom and dad don't have Medicaid, can't get Medicaid. So we're going to do that based upon Charlie or Sarah, right? And then award Medicaid and waiver based upon the child. So we look at income and resources first, answer all those questions. Once we get kind of a determination back, either over-resource or you would have a spin down. And typically a spin down, if you think about it, is like a monthly premium on your insurance. It's the easiest way I can explain it. It's not perfect, but it's the easiest way I can explain it. That's so high you can't afford it, okay? And then we go, okay, and we start working through the actual development of an individualized support plan and the official request for funded services through utilization review.
We did get a pre-submitted question, and I'm not sure that this is your purview, but you told me that you would be happy to answer. So I know that we've had families bring this concern up where they are trying to connect with their case manager and they're not getting any response. They're not getting a phone call back or an email back. And for some families, they may wait a considerable length of time for that. What's the best course of action for those families to take?
That's a great question, Sharon. Always know that within the department, there is a chain of custody, chain of command. So if you don't hear from your support coordinator, then you can reach out to the supervisor. If you don't hear from the supervisor, you can reach out to the assistant director. If you don't hear from the assistant director, you can reach out to the director. You always have somebody else that you can call. God forbid you don't hear from the director. You can call central office, right? There's always somebody higher up the food chain. And that's true even with our privatized case management agencies, right? Things happen, but we know that our private partners are committed to working with folks. And sometimes things happen. So you may work your way up through the chain of command at the agency. You always have that next step to come back to the department and say, yeah, I haven't gotten what I need. Can you help me? Okay. So
I think that's a great
there's
answer.
Always somebody else.
And I would also tell families that if you feel like even if that case manager's responded to you, if you don't feel like they are good for your family, if they're not meshing with you, if they're not meeting your needs, you can request a different case manager. Just know that you're requesting from a pool of people that all have large caseloads and may be struggling to keep up with things. So we often will help families kind of navigate that. If you feel like your case manager, you're not sure they're the best fit for you, call one of the ARCS navigators and maybe we can help walk through that conversation with you. Because sometimes they're doing the best they can. And if we step in and provide a little bit of support, we can get them moving. Matt also mentioned, and I want to make sure we take a minute to talk about it here, that our region is getting a new private case management service that's going to take some of the burden of those very high caseloads off our Department of Mental Health service coordinators. So the Center for Human Services is a statewide organization that's new to St. Louis. They're going to be doing case management in St. Louis County and taking a portion of the current folks that are assigned to Department of Mental Health case managers. That has already started, so people are starting to trickle over to them. I do want you to know that if you get notified that you're getting transferred and you haven't heard from the new person yet, please be patient. The transition of those names between DMH to CHS sometimes is slower than others, so they may not even know yet that that you've been transferred to them. But we'll probably have Center for Human Services on sometime in the near future so you can get to know them, but it'll be the same type of service coordination. Their caseloads are going to be a little bit smaller. They're going to have caseloads of about 35, so that should be a nice opportunity for families.
You know, and I think that's a great kind of caveat to say. We heard families say, I need help, right? And so we're not going to get more full-time employees, right? That's state government. But they worked very, very hard to figure out how to serve. And we're talking a large number of people, a couple of thousand will eventually be transitioned over to Center for Human Services. We're very excited. It's a great partnership. It benefits the division. It benefits the people of St. Louis County. It's a win-win.
Yeah, I think it's going to be a higher quality of services for all families. I think Center for Human Services will do great. And I think the Department of Mental Health will have an opportunity to take a breath. Newer case managers will have a chance to learn some of the pieces that it's hard to do now because they are so highly involved. So we've got a question from Elizabeth. And if I don't answer this or ask it the way you wanted it to be, please drop another question in. But Elizabeth asked if there was any time frame you could provide for eligibility of the waiver program. So I'm assuming that means from kind of the start of having Medicaid eligibility and asking for a waiver service. What can families expect?
So it's a great question. I'm going to assume that we're saying they've already got Medicaid. We're not talking about the MoKids waiver because they are vastly different. And I would be remiss to give you an exact. But I would say a couple of months to be conservative, to recognize, okay, we've got to have the meeting, we've got to write the ISP, we've got to determine the justification, we've got to identify the service, develop a budget. You know, right now, we've got a pretty significant staffing crisis. I think everybody's seeing that, whether you work at Dairy Queen or the Department of Mental Health, right? There's a significant staffing crisis. So services can be authorized sometimes, and then there's a lag just because agency doesn't necessarily have the staff at the moment. But I think getting through that process and the utilization review, and then if there are questions or corrections, I think understanding a couple of months, maybe 2 to 3, is pretty conservative, right? I'd hate to tell you we can have it done in a week, because the last thing I want somebody to do is say, Matt Wagoner said, right?
Well, and to be
Um,
honest, Matt, we've had families go longer than that. So I think it's important, Elizabeth and everybody else out there, to also know that it's multi-stepped. And Matt alluded to this. You can be eligible for waivered services, but that doesn't mean that you're just handed money to get a service. At that point, you have to have a written individual support plan that talks about what your needs are and what kind of services would meet those needs. Then that plan goes anonymously to the utilization review committee for determining whether or not they can pay for it or not. So that's next step. If they say, yep, we're going to pay for this service, then you have to go find an organization like the ARC who has an available spot for you to go and use the service. So unfortunately, it becomes a lot of stop and start for families because Matt's right. We are in a challenging time right now. I know that there's waiting lists for almost every single program at the ARC, some of which are 2 weeks long and some of which are 2 years long. So that's part of the role, I think, of both Matt's job and the navigator job at the ARC, is to work with families who are stuck in that stopgap and figure out what to do while you're waiting for the right matches to come along. So Matt, I know that you were excited about coming on today. We're running out of time. So I want to make sure that when you thought about joining us today, are there things that you think, oh, I wish families knew this, or I wish that they didn't call me about this so often and they just knew they could get this done? What were some of the things that you wanted to make sure we covered today?
The main things I want families to think about is there a Medicaid program that might be appropriate for me? I think that there's still, even though it's 2023, there's a little bit of taboo about applying for Medicaid. And my attitude is, and our attitude is, it's a benefit that you've paid into. Okay. And your application to Medicaid doesn't take somebody else's services away, right? And if it puts a strain on the system, then it puts a strain on the system, and it shows where we need supports. Individuals in the DD system have needs that are higher than other individuals. And that Medicaid system provides some services and supports that help alleviate, maintain the family, take some stress off. And so I always want to talk to families about is there a Medicaid program? And then obviously the MOKIDs, we talk a lot about MOKIDs. We got a lot of people, so be patient with us, but don't be like, well, let it lie. Call us back, email me, whatever you need to do. Unfortunately, sometimes things fall through the cracks, and I hate to admit that, but it happens. But call us and let us know we missed it, right? We can fix it. So yeah, those are the things that I want families to think about.
What's the age cap to apply for MOKIDs?
17 and a half. Okay. So let me just tell you that when we're starting on the MOKIDs process, it typically, in general, can take about 6 months to do all the steps that have to be done to get onto the waiting list. Hear me say that. There's a wait list, okay? 6 months. But if your kiddo is going to hit 17 and a half in the middle of that process, we can't even start it. Now, Medicaid will allow us to submit an application for Medicaid when they're 17 and 9 months. So at 90 days from their 18th birthday, we can go ahead and start the process, right, of getting all that paperwork, because Medicaid for age blind and disabled is a longer process, because it's not only an asset review, it's also a medical determination. So it's 2 reviews. So it takes longer, okay? So for the MOKIDs at 17 and a half, we're going to say, no, we can't help you. And it's never too early. We have kids in the MOKID system that are 1, 2 years old.
Yeah, I tend to agree with you. I don't know that there's a whole lot of downsides to getting Medicaid. I do want to just clarify for our families that in order to make an informed decision, if you have Medicaid, you have to know that if you are pursuing a Medicaid waiver, it could impact your access to services from our SB 40 boards. Not always, but quite often. So again, that's another place to grab a phone, call me, call Matt, and just get some clarification so that you're making a decision that's right for you. And in, I don't know what that is. So, but I can tell you what the different implications are going to be based on the choices you make. Matt, thanks so much for giving us this time today. I think it was really great to be able to hear directly from you about how the information specialist position is available to help our families navigate that gap.
Thank you. It was a pleasure.
Thanks. See you soon, everybody.